Well, good morning. Welcome to Facebook Live here at Hancock Health. My name is Steve Long. I'm the CEO here. It is a pleasure to be here with you this morning. Now, I am actually standing in a different spot that you may have seen before. Usually we're in my office surrounded by all that car stuff. And Victor Valley, if you're watching, I was going to have the helmet in the picture today, but it's up in my office and I'm not in my office. Well, where I am is in our Keene classroom, named after our retired CEO, Bobby Keene. And Bobby, if you're out there watching this, we love you, man. I hope you have a great holiday. But we are in the Keene classroom, which is going to be the epicenter for the first rounds of COVID vaccination here in Hancock County. We are a Phase 1A hospital, and so we will begin receiving shipments of vaccine here in a couple of weeks, and then our goal is to vaccinate all of the healthcare providers in Hancock County, and frankly, in Shelby County as well, in a partnership with Major Hospital, so that we can begin to get on the road to getting out of the pandemic. Because the only way out is through herd immunity, and we're not going to wait 10 years like it would take just for everybody to get sick. We're going to get it done through vaccination. So it's going to begin in a couple of weeks. It's going to be right here in this room, and you can see we've already got our process set up. We have the room set up. We have the logistics figured out, and we're going to get this done, and it's going to be great. So I just want to thank all of the people that are engaged with us for our vaccination team. They are working through all of the logistics, and I will tell you, as a country, we have never done anything quite so difficult as beginning to vaccinate 330 million people. It's going to be an incredible thing to watch, but we are right there on the front lines at the front edge of the entire process. You know, that's one of the great things that's really happening now, is because we see the light at the end of the tunnel. The other one is that we now have some pretty fantastic treatments that are available. So there is a word of a drug that I'm going to try to say right now, and if Dr. Fletcher was here, he could say it for me. But I believe it is bamlanivimab. I got it almost. Whatever I said. Bam, we're going to call it. And it is the monoclonal antibody that our very own Lilly has developed for use in outpatients that have been tested positive for COVID. They got to have some risk factors and they have to have some symptoms. But you know what? It works miraculously and it helps people not end up in the hospital. So we're beginning to do that as well. Your primary care physician knows all about this, so that if you have questions, please call them or go to our website, hancockregional.org. So just know, we're in a very different spot than we were at the beginning of this pandemic, because the vaccine is almost here. This really great treatment actually is here already. But the fact is that we're not out of it yet. And the problem that we're having is that people are really engaging their COVID fatigue. I am too. It's hard to wear this mask and wash your hands and keep your distance all the time. But you know what? It has never been more important than now, because we are almost out of this thing. We can see the light at the end of the tunnel. So what we would ask is that you actually be very intentional about it. Wear your mask all the time when you're out and about. Avoid crowds and wash your hands all the time. Do these simple public health prevention steps that will help us ride out the rest of this pandemic so that we can get everybody vaccinated. So please know, I can't wait to get vaccinated. I'm not going to be first in line because I'm not a frontline caregiver, but as soon as my turn comes up, I'm going to be right there. Because I've been reading a lot, and I've been talking to our physicians a lot, and it is effective, and it is safe, and I can't wait to get it, because it's just another step on the road. So let me just leave us with this and say we're going to do a special Facebook Live tomorrow at noon. We're going to be interviewing a local community leader who actually had a journey through COVID, and he's agreed to talk to us, and I'm looking forward to that because I think his story will be very meaningful and helpful for all of us. But in the meantime, make sure you wear your mask, wash your hands, keep your distance, make sure that you're planning to get the vaccine as soon as it's your turn, and we are going to get out of this because the light is at the end of the tunnel. Thanks for being with us. Hancock Health Facebook Live. Join us again tomorrow at noon, and we'll see you then.